Hey, this is Dr. 𝗲-𝙧𝗱 with Pro Holistic Care, and today I want to talk to you about headaches and neck pain. So many times we have patients come into the clinic and we're doing our initial intake with them because, we've got to start with getting all the information to figure out why you're having the problem. People will talk about how their headaches and their neck pain are normal. So we want to talk a little bit today about how headaches and neck pain are common. It happens a lot, but they aren't normal. It's not something that we need to be living with every single day. I want to talk a little bit about why they're happening and what we need to do to figure out how we can help you correct those headaches and neck pain and get rid of it for good. So a lot of people come in with either or headache or neck pain, sometimes both. And the very first thing we need to do is figure out why you're having that pain. So during our consultation, we're going to get a thorough history, figure out when you're having the headaches, why you're having headaches, anything we can attribute to the headaches or triggering the headaches. But the really most important thing to do is figure out where that headache is coming from. If we can figure out where the headache is coming from and where the neck pain is coming from, we're going to have a much easier time figuring out exactly how to fix it. So you can see on my pictures behind me here, there's some certain things we want to look at during our exam and x-ray process to figure out where the next pain is coming from and the headaches. So a lot of times people will come in and they've already had x-rays taken and they've been told that everything's normal. Now, again, that doesn't necessarily mean that it's healthy. It's common to have some structural problems in the neck, like postural issues with the discs, and for a healthcare provider to tell you that it's normal. When they're saying it's normal, what they're really saying is there's nothing broken, there's no fracture, there's nothing extremely severe in the neck that they would consider an abnormality. However, small changes in the neck, in the posture, in the discs and the bones can make big problems as far as neck pain and headaches go. So one of the things we want to see when we look at a healthy x-ray of a neck is we want to see a nice curve to the front like this, if you can see that on this picture. That curve really helps to decrease the weight from the head on the shoulders and the neck. If we don't have that curve, a lot more pressure is put down because the curve acts like a shock absorber. And if you lose that curve, eventually you're going to start to have problems with the bones and the discs. Now, if we start to have problems with the bones and the discs, we're going to start to put pressure on the nerves in the neck. So if the discs that lay in between the bones and the neck are not big enough, the nerves that come out from the side do not have enough space. And that's when we're going to start to have pain and problems, because anytime there's pressure on a nerve, it causes pain and problems. And again, this is really common. It's common because we have poor posture. It's common because we're sitting hunched over at a computer for hours and hours, probably almost every day for certain people. So it's a really common problem, but that does not mean it's normal. And when we start to have compression on those discs, we can either get neck pain, which again is common but not normal, or we can start to get headaches, or both. When we have a problem or pressure on the nerves in the neck, that's going to cause neck pain, tension, spasm, those ropey muscles you can feel. It can feel like your neck is stiff and your limited range of motion. And eventually that can lead to compression of the nerves at the base of the skull. These nerves travel up to the head and can cause headaches. So when we examine, we're going to look for the movement of the bones. We're going to check the muscles, the tendon and ligaments, see exactly what's happening. And we're also going to take an x-ray of the neck. Again, a lot of times people will come, I already had an x-ray of my neck. Well, they're just looking to see if there's anything broken or a huge, abnormality there. What we're really looking for is small changes that can put compression on those nerves. So we're going to take a picture of the neck from the side, from the front, and then we're going to take a picture with you bending your head forward and back so we can see if the neck is moving properly. We can notice if there's any areas where the nerves are starting to be compressed by the bone or by the disc, or if there's just not enough space for it. Once we do the physical exam, checking everything with our hands, doing orthopedic testing, and we take those x-rays, we can really figure out exactly where that problem is coming from and target it with our chiropractic treatments. We also use chiropractic, physical therapy modalities, and acupuncture to figure out the best way to treat you. So again, when you're having pain, you're having headaches, and you're thinking, oh man, everybody has these. I work on a computer. It's just normal. I just have to live with it. Let me pop an Advil, a Tylenol, something like that. You know, those will get rid of the symptoms for the short term, but it's not going to correct the problem long term, and you don't want to do that all the time. So think about getting checked out by a chiropractor. You can find out exactly where that problem is coming from. You can find out why you're having neck pain, why you're having headache pain, and you don't have to just think, oh, this is something normal that everyone has and I have to live with it. We can actually figure out the cause and help you figure out a plan to get rid of the problem. Thanks, Dr. 𝙬-𝙧𝙖𝙮𝑃RO Holistic Care.